I'm Jennifer McDuffie. Welcome to Newsoft's Medical Practice Management podcast series. This month we're talking about human resource issues, and joining me is Denise Algier, a consultant with Risk Navigation Group. Hi, Denise.
Good morning.
So the title of this podcast is Reducing Liability and Improving Employee Satisfaction Through Strong HR Policies. And I want to focus first on the liability piece. Tell us about some of the laws and regulations that should concern medical practices as they relate to hiring and also to the ongoing management of employees once they are hired.
Absolutely. Well, in medical practice, there are not just physician medical practice, but healthcare in general, there are a lot of regulations that are required in terms of onboarding employees. There are the standard requirements that you see in other business, but in terms of healthcare, there are regulations under Medicare and Medicaid that require specific background checks for employees that have direct access as well as indirect access to patient information. And that requirement was brought about based on, over the last 10 years, findings or things that have occurred with bad hiring decisions where either patients or coworkers have either there's been a bad outcome in that bad hire that has either affected a patient or a coworker. And to protect the safety of patients, Medicare and Medicaid, under regulations under the Office of the Inspector General, which is under the Health and Human Services Organization, they require specific background checks, including criminal background check, checking against a national registry that keeps a list of individuals that are not allowed to work in facilities that receive funding. So, for example, most medical practices receive Medicare and Medicaid funding either through commercial health plans that also have Medicare and Medicaid components to them, as well as direct Medicare contracts. And in order to receive payment for those services, these background checks are required. So what can happen if a bad hiring decision is made? Well, if there is if a patient is affected or a coworker is affected, the medical practice is open to significant liabilities. The average healthcare providers pay on average $200,000 for claims for damages for poor hiring decisions. And some of those damages occur because either there's been an issue with a coworker or perhaps something that's happened with a patient. And when a patient is directly affected, there's actually more damages or more potential for damages.
Do you think that the average practice understands these laws or is even aware of them?
Well, what we're seeing more now is that many health plan contracts include these requirements. And if you're signing for the first time, perhaps a new contract with a payer, it can be buried within that contract. So the provider may not be aware of that. But if you are, oftentimes what health plans will do is they'll send out amendments or updates that make you aware of these requirements. So I would say that most healthcare providers are probably aware of the requirements for physician assistants, mid-level providers, but maybe not so much that these same requirements are in place for anyone that has access to either the patient directly through, say, a medical assistant or through someone that has access to the patient's confidential information, say their social security number, their billing information, their protected health information. So I would say it's yes and no. I mean, they're probably aware of it in terms of the requirements for a mid-level provider because that's part of the standard credentialing process. But for other employees that work within the medical practice, they may not be aware of that.
So if a practice is not compliant, what are some of the risks?
There are federal and state requirements. So from the federal side, as I said, the risk is that if it is found that a healthcare provider is employing someone that, say, is on the list of excluded individuals under the Office of the Inspector General, which is the federal requirement that we spoke about earlier, if a provider is found to have someone that is on that list, then they could be required to not only pay penalties, but to repay any reimbursement that was paid to the practice back to the date that that person was hired. So there is significant risk in terms of both financial liability and risk if there is a formal complaint made.
What about some of the non-financial risks that practices might not be thinking about?
Well, obviously, some of the intangible things or things that maybe you can't quantify financially would be the impact to your reputation as a healthcare provider and the impact that could have. Because many times when there are negligent cases, I'm sure we can all think of things that we've seen on the news where there's been either a workplace violence event or negligence on the part of an employee towards a patient. The impact to your reputation can be significant. One of the case examples that I remember reading about was there was a practice that had hired a medical assistant that she was actually a certified medical assistant, and in part of the hiring practice, she had relocated to the location where the medical practice was, and didn't have a copy of her certification. And the practice, accepted that, thinking, well, she's in the process of moving. Well, a thorough background was not completed from her prior location in terms of where she lived previously. Anyway, to make a long story short, this person had a criminal record. And an event happened with a patient, and a patient filed a suit, and it was later discovered that a thorough background check was not completed, and furthermore, they didn't even have a copy of the person's certification. The damages were over $1 million to the medical practice. Wow. And that, of course, we can say, yes, there was $1 million in financial damages, and perhaps our liability policies might cover a portion of that, if not all of it. But the real underlying damage that's hard to quantify and affected the practice for years, I would say, would be the publicity of that event and how that would affect both their referrals from other medical providers, as well as a patient's impression and how the public would view that.
And you might never recover from something like that as a practice.
Absolutely. Patients, when they go in to see a provider, they're vulnerable, and they expect to be treated in a safe environment, physically safe, as well as their personal information.
Right. Yeah, I think that I read somewhere that a lot of the cases of identity fraud happen when people go to the doctor and have to give their social security number and their information, and it doesn't end very well for them.
That risk, actually, that you bring that up is actually on the provider's side as well. Because providers are extremely vulnerable. They part of the credentialing process for a medical provider includes a lot of very detailed information about them personally, their social security number, their home address, their business address, their tax ID number, their date of birth, all of the places that they've lived in, and oftentimes, a copy of all of their licensing information. And if employees have access to that information, there's a significant potential to the provider as well.
Yeah, they could accrue some pretty hefty fines, it sounds like.
Significant fines. And under the liability side, as I said, the average damages resulting from poor hiring decisions average about $200,000. However, if the damages are to direct negligence towards the patient, the risk is much greater. There's a significant impact there in terms of potential liability as well as penalties from your reimbursement policies.
Certainly there are practices with HR people in place, office managers who are trained and knowledgeable about these issues, but there probably are also practices who maybe don't have the HR backgrounds or capabilities. For practices who are in this situation, can you give us perhaps 3 basic things that they can do to minimize the risk from from a fine or from a lawsuit even?
Well, first of all, there should be consistent hiring practices. There should be a policy in terms of what, the process that's in place for onboarding all employees. And there may be different requirements depending on the employee's role. Say, the background check requirements for a physician assistant may be different than a biller or coder, but there should be consistent requirements that are documented in a policy. So one, I think first and foremost, you need to have a well-defined policy. And second of all, the medical practice should not try to manage this themselves. There are plenty of organizations out there that conduct background investigations, and having them put together a detailed plan would be important. And finding someone that has experience in healthcare and what the requirements are also important. And then additionally, I would add having human resources policies in general in terms of once an employee is hired, what the follow-on background requirements are, because the Office of the Inspector General, what they require is that you check against this list upon hire, but then also have ongoing check against the list to make sure that someone after you've hired them have not been added to the exclusion list.
So certainly there's a lot to think about during the hiring process, but once an employee comes on board, what should practices be thinking about in terms of HR policies then?
Absolutely. There should be a good practice would be to have an employee handbook, and that employee handbook should outline several policies and procedures that the company has in place. Some of the common policies and procedures would be your ethical standards, any policies that you have in terms of time, a general statement about benefits. I usually don't encourage practices to have detailed information about benefits in your employee manual because oftentimes those change. And then any security policies, IT, property policies are usually included in an employee handbook. And again, as we talked about previously, sometimes smaller practices may not know how to start with something like that. And there are many resources available either through MGMA or outsourced human resource consulting groups that can help you put those things together fairly easily from a template. Additionally, there should be a well-defined policy in terms of employee evaluation. When someone is hired, there should be, say, a 30, 60, 90-day evaluation and then an annual evaluation that goes on with employees ongoing. And that should be well communicated to the employee so that they know what to expect. That can also affect employee satisfaction. If they, sometimes if an employee will go for a year or two without an evaluation, they wonder, how am I doing? Is the physician or office manager happy with my performance? So having a consistent policy in terms of employee evaluation is also important.
Yeah, and probably some mechanism for ongoing feedback in between the formal evaluation periods, right?
Absolutely. Both positive and any constructive feedback that you need to provide the employee.
I think we've covered a lot of the reasons why having the policies and the procedures, the consistent policies and procedures during the hiring process will benefit medical practices and specifically through reducing their risk. Talk about how employees and even patients can benefit.
Well, the benefit to employees is that they know that fair hiring practices are being applied across all employees. I mean, sometimes, particularly in a small group, if you have less than 20 employees, maybe even less than 10 employees, sometimes it can be a very informal process in terms of hiring. And if there's question of inconsistency, sometimes employees can feel that they're being isolated. So if you have a well documented and communicated plan from the outset, then employees know what to expect, and they know that they're treated fairly and consistently. From a patient's perspective, patients want to know when they come in to see a healthcare provider that their information is safe and that their private health information is protected, and that they're being treated by individuals that have been properly screened and are, you haven't hired someone with that could potentially cause harm to the patient. Additionally, patient satisfaction is critical, and having someone with where you've communicated your customer service policies and the organization standards in terms of customer service, having that communicated both to employees and to patients, they both know what to expect. And generally, a patient will know when they walk into a physician's practice whether or not they're going to receive good care based on the impression that they receive from the employee that first greets them either on the telephone or in person. So all of those things can be impacted by consistent practices.
That makes sense. Can you suggest maybe some good resources for practices that may need to look at their HR policies and practices? Where can they turn?
There are many organizations that offer outsourced HR services. If you don't have human resources within your medical practice, say your payroll processing company, many of them offer consultant HR services. Additionally, MGMA, which is a national organization, also has many resources on site. And if the medical provider is a member of the MGMA, they can access many of those resources free of charge or at a discount if they're buying, say, template policies and procedures. And MGMA actually does have several template policies and procedures for human resources that capture most of the requirements. Now, specific state requirements may be different depending on where your jurisdiction, so it's important to make sure that you meet those state requirements as well in terms of your policies.
Well, thank you so much for shedding some light today on this topic, and thanks to all of our listeners for tuning in, and be sure to listen next month. Thanks, Denise.
Thank you.